the reduced immunity that we have due to the lack of flu virus over the last year could result in an early and perhaps severe flu season this year. In addition, the relaxed COVID-19 mandates so far with respect to, relaxed stay-at-home mandates and perhaps a little more relaxing with the mask mandates could also result in the increase in flu activity this year as well. In August, in the state of Arizona, so far we've got a little over 40 cases of lab confirmed influenza. And in the first 2 weeks of September, we've had about 8 cases so far. So the cases continue to be low. But one thing to note, when I was just reviewing the CDC website over the last few days, there was a teen or a child in the state of Ohio that contracted the swine flu, but had no links to pigs. And so they concluded that it might have been from a person to person transmission. And this is important because the 2009 flu pandemic was due to the swine flu. And so far this year, across the whole country, none in the state of Arizona, we've had about 10 reports, and all but one, which is the one report in Ohio, have had some sort of connection to pigs. And so this is likely nothing to worry about, but something that I'll be continuing to watch weekly on the CDC website.
There's been a coupling of terminology known as the twindemic. What do you want to say about that when people are now worried about having the flu and COVID-19 at the same time, or not being able to differentiate between those two?
People that develop either COVID-19 or the flu, like you're mentioning, they can have very similar presentations. They can have fever, cough, shortness of breath. They can have headaches. They can have muscle pains. And so the presentations can be very similar. And it's not common, but sometimes people can have both infections at the same time. And so your healthcare professional that you would be seeing for this will be able to order the test to know whether you have either COVID-19 or the flu. And so, given that the most prevalent virus right now is the SARS-CoV-2, the virus that causes COVID-19, it's really important to first rule out that infection. And if that test then comes back negative, then the healthcare professional can then decide whether he or she will want to order additional testing, look for other infections, including influenza at that time.
And what about concerns as far as the vaccinations? For example, somebody got both COVID vaccines, and now they are wondering whether it's safe to get the flu vaccine.
We don't have a lot of information about this, but per the CDC, the COVID-19 vaccine can be administered simultaneously with any other vaccine. When we're kids, usually around the age of 4, 'cause I just had my son, he's 5, and when he was 4 years old, he had about 4 or 5 different vaccines given to him at the same time. And we also do that for people that have weak immune systems. We give them multiple vaccines at the same time, and they all do really well. And so it's really important to get both vaccines. And so if you haven't had either vaccine, I would really recommend getting both vaccines at the same time. And you can get it in both, one in each shoulder, and you should be fine.
You are obviously in favor of vaccinations. You're encouraging everybody to get vaccinated for both the flu and the COVID-19.
Absolutely. Yeah, I think they're both very safe and very effective in preventing illnesses. And so in order to protect yourself and your loved ones, I think it'd be really important to get both vaccinations. Absolutely. As long as there's ample SARS-CoV-2 virus in the community, both locally, nationally, and internationally, the virus has more and more opportunity to replicate and be able to develop mutations and other variants. And so it's definitely possible that the more viruses out there, the more opportunity it has to make more variants, which is why vaccinations is very important, because if you're vaccinating everyone, then the virus doesn't have as ample opportunity to be able to replicate within us and be able to pass from person to person. So that is why vaccination is very important, to be able to decrease the community virus spread in order to decrease the number of variants. And same with influenza as well.
Dr. Saman Matohali, thank you very much for joining us.
Thank you very much. It's a pleasure to be here.